What is the status quo with regards to the race for a vaccine, and where does Africa stand? I mean, we're talking about policy proposals. Equity has been very much at the center of that, but how do we work around it in this multilateral system where we know that not all are equal?
Good evening, Tsepiso, and good evening to the listeners. At this point in time, we do not know precisely what the strategy is for Africa to access the vaccine. But what we know definitely from the multinational companies is that there will be vaccine that will be accessed. My take as a researcher is that the queue is long. Remember, a few days ago, the president was talking about securing $12 billion for the continent. I am not certain how much has been secured to date, but all I am certain about coming from this meeting today was that there will be vaccine and it will be prioritized. And certain that you would know about the COVAX facility, which says that at least 20% of the country's population must have an access to the vaccine. There will be terms and conditions that will be negotiated per country. And I think for the benefit of Africa, those terms and conditions will most likely be negotiated either at the regional level or at the AU level, because as I understand, the chairperson of AU currently is really trying to make this a united approach by all means, so that no country is left behind. But also importantly to note from Pfizer, I mean, like Pfizer, I think as one of those companies that came out first last week, they mentioned their commitment to not competing negatively with other manufacturers, because that would put a strain on the supply chain of vaccines. So they welcomed the fact that other companies are announcing the successes of their trial candidates of vaccine. So, yeah, so what I got from today's meeting was that there will be access that will be assured.
But I want to talk about what have traditionally been the historical challenges when it comes to access to vaccines. I mean, we have quite a lot of experience with regards to the development of vaccines, but a lot of the health crises we've had to face have been very much, limited to Africa, so to speak. If we speak about the Ebola virus, WHO, for instance, announcing that the 11th outbreak has now been ended, but wouldn't have been an international rush to get one, to secure one. So what lessons have been learned in the past?
Like you say, Ebola unfortunately was a pandemic that affected fewer countries as opposed to the rest of the world. So it becomes different now with COVID. And so I think it's also a struggle currently to understand traditionally what have been the challenges as far as securing a vaccine or a medicinal intervention for a pandemic, for a global pandemic for that matter. So that remains a question. But traditionally, I mean, like, vaccines do take long. I mean, like, that's something that we have all learned. It's something that was known in the fraternity, but then now with this pandemic crushing the economies, we have all come to learn the fact that vaccines take long. But also, we have also come to appreciate the innovation that has been invested in for the past few years or over decades, that now we need to develop vaccine in a rush. But of concern also is that Africa is going to miss out on this opportunity to manufacture, for itself. Dr. Mahuana from the BioNTech, when he showed just how the rest of the world is manufacturing the vaccines for Africa, but Africa is not manufacturing the vaccines for itself. It is a problem in terms of Africa wanting to salvage its economy currently. So for us, this dialogue was not only a matter of access, it was a matter also of how can going forward look at medicines and vaccine manufacturing as something that is worthy to invest in for the purposes of growing Africa's economies. So it will be.
I mean, South Africa has, in a way, done that alongside with India, requesting the WTO for a waiver when it comes to the intellectual property rights of COVID-19 medicines. And there has been a bid to try and better capacitate local companies when it comes to the manufacturing of vaccines. But I'm interested also in finding out just the WHO strategy on the rollout and distribution. Is it going to be country or regional specific? So is there anything that will better capacitate countries to do those kinds of things?
Yes. At this point in time, what WHO flagged was that country preparedness needs to be assessed, and there are tools to do that. And I got the sense that the rolling out will be a bottom-top approach, sort of. I mean, like, not, of course, when the vaccine comes in, it's a country that allows for a vaccine to be available to the population. But the preparedness needs to start from a province. It must be there must be preparedness from a local structures of healthcare. So that is how they are intending to have the vaccine rolling out. Secondly, vaccines, I mean, like we're looking at having multitudes of vaccines that can secure safety for various reasons. For instance, there is a vaccine that has been shown to be efficient with elderly population. So we might have to prioritize elderly population first and make sure that they can access that. And also we might have to decide on the basis of, let's say, for instance, high morbidities or comorbidities exist in a particular province. So it means those provinces will have to get priority to vaccines, and will have to, through the tracing mechanisms that were being used for the identification of their COVID patients or victims, that may have to be applied as well.
Let me ask one final question. Is there an assumption that it's going to be compulsory? And if not, what happens to those who then don't want to go the route of a vaccine? Because it's about safety issues and the buy-in of the populace. I believe there's been various studies showing that in Indonesia and Pakistan that people won't accept a vaccine unless it is 95% plus safety guaranteed.
As far as what came out clear is that you cannot force people to take the vaccine. But then there are two strategies that may be used. If a person does not want to take a vaccine, we may have to go the court route. But also that is cumbersome. So in order to make people take vaccine, you may probably have to look at people who are willing to travel. So any person who needs to travel may have to take that vaccine, just like with the yellow fever. Secondly, another important factor that came out was the fact that vaccine rollout must take into consideration the context and the cultural perspectives of the locals that must receive that vaccination. So those are some of the things that the Department of Health will have to look into. And I think now more than ever, the issue of accepting or refusing a vaccine, it is going to be a point of a debate, and for quite some time, because I don't think it has been an issue. People have had choices, but then it was not a contested area of taking a vaccine or not taking a vaccine. But also remember, with the COVID, it does bear the economic implications. If people do not take vaccines, you are risking not only other people's lives, but you're also risking the economy. So it is a debate that still needs to be on.
And certainly a conversation will continue with you. Thank you very much. Human Sciences Research Council's Senior Specialist Researcher, Dr. Palesa Sekhejane.